I'm going to tell you something that might surprise you. If you've ever wondered whether that uncomfortable itching and unusual discharge you're experiencing could be a yeast infection, you're absolutely not alone. In fact, I'd wager that nearly every woman who walks into my office has either dealt with a yeast infection or will at some point in her life. And here's what I find fascinating. Despite how incredibly common these infections are, there's still so much confusion, embarrassment, and frankly, misinformation floating around about them. So today, I want to have a completely honest, science-backed conversation about yeast infections. I'm going to tell you exactly what they are, why they happen, how to recognize them, and most importantly, how to treat and prevent them effectively. By the time we're done talking, you'll feel confident recognizing the signs, you'll know exactly what to do when symptoms arise, and you'll understand why your body sometimes rebels in this particular way. Because here's the thing, knowledge is power, especially when it comes to your health. Let me start with something that might put your mind at ease. Having a yeast infection says absolutely nothing about your hygiene, your lifestyle choices, or your worth as a person. These infections are so common that about 75% of women will experience at least one during their lifetime, and many will have multiple episodes. It's not a reflection of anything you've done wrong. It's simply your body's natural ecosystem getting temporarily out of balance. Now let's dive into what's actually happening when you develop a yeast infection. Your vagina is home to an incredibly sophisticated ecosystem. Think of it like a bustling city with different neighborhoods. In this city, you have beneficial bacteria, primarily lactobacilli, who are like the friendly neighborhood watch. They keep the peace by maintaining an acidic environment that prevents troublemakers from taking over. Then you have small amounts of yeast, primarily a fungus called Candida albicans, who under normal circumstances are perfectly well-behaved residents. But sometimes, this delicate balance gets disrupted. When the good bacteria can't keep up with their peacekeeping duties, the yeast can multiply rapidly and cause what we call vaginal candidiasis, or more commonly, a yeast infection. It's like when the neighborhood watch goes on vacation and suddenly the troublemakers start throwing parties and causing chaos. So what causes this disruption? Well, there are several culprits, and understanding them can help you prevent future infections. The most common trigger is antibiotics. Now, don't get me wrong, antibiotics are lifesavers when you need them. But they're like a bomb that doesn't discriminate between good and bad bacteria. While they're fighting the bacterial infection you're taking them for, they can also wipe out the beneficial bacteria in your vagina, leaving the yeast free to multiply unchecked. This is why so many women notice they get yeast infections during or shortly after taking antibiotics. Hormonal changes are another major factor. Your hormones are like the weather system in your vaginal ecosystem, and when they fluctuate, everything else can change too. Many women notice they're more prone to yeast infections right before their period when estrogen levels drop. Pregnancy is another time when hormonal changes can trigger infections. The high levels of estrogen during pregnancy can actually feed yeast growth, and the changes in your immune system can make you more susceptible. Your immune system plays a crucial role here. When you're stressed, not sleeping well, fighting off a cold, or dealing with conditions like diabetes or HIV, your immune system might not be able to keep the yeast population in check as effectively. Even something as simple as being run down from work stress can sometimes tip the balance. Now, let's talk about lifestyle factors, because I know many of you are wondering if something you're doing is causing these infections. Wearing tight, non-breathable clothing can create a warm, moist environment that yeast absolutely loves. Those cute skinny jeans might look great, but if you're prone to yeast infections, they might not be doing you any favors. Same goes for staying in wet bathing suits or sweaty workout clothes. Yeast thrives in warm, moist conditions. Some women find that their diet affects their susceptibility to yeast infections. While the science isn't completely clear on this, some women notice that consuming large amounts of sugar or refined carbohydrates seems to trigger infections. The theory is that high blood sugar can feed yeast growth, though this varies significantly from person to person. Now let's get to the symptoms, because recognizing a yeast infection is the first step to treating it effectively. The hallmark symptom is intense itching around the vulva and vaginal opening. And when I say intense, I mean the kind of itching that can wake you up at night, make it hard to concentrate at work, and generally drive you absolutely crazy. This isn't just mild discomfort. It's often severe enough to significantly impact your daily life. You'll also typically experience a burning sensation, especially when urinating or during sexual intercourse. This happens because the tissues become inflamed and irritated, so any contact, whether it's urine or friction, can be quite uncomfortable. Many women describe it as feeling raw, or like there's a constant stinging sensation. The discharge is another telltale sign. With yeast infections, you'll typically see thick, white discharge that looks remarkably like cottage cheese. It's quite distinctive, chunky, white, and usually doesn't have a strong odor. If there is an odor, it's typically described as slightly yeasty or bread-like, not fishy or foul-smelling. This is actually one way to distinguish yeast infections from other types of vaginal infections. You might also notice swelling and redness around the vulva. The entire area can become puffy and tender to touch. Some women develop small cracks or fissures in the skin, especially if they've been scratching. In severe cases, the inflammation can be so significant that even wearing underwear feels uncomfortable. Here's something important to understand. Not every vaginal infection is a yeast infection, even if you've had them before. Bacterial vaginosis, for instance, can cause some similar symptoms, but typically produces a thin, grey discharge with a strong fishy odor. Sexually transmitted infections can also cause vaginal symptoms. This is why I always recommend getting a proper diagnosis, especially if you're experiencing symptoms for the first time or if they're different from what you've experienced before. If you suspect you have a yeast infection, you have several treatment options. Over-the-counter antifungal medications are highly effective for most uncomplicated yeast infections. These come in different forms: vaginal suppositories, creams, or oral tablets. The most common ingredients are miconazole, clotrimazole, or fluconazole. You can choose between 1-day, 3-day, or 7-day treatments. The shorter courses are more concentrated and convenient, but some women find the longer courses with lower concentrations are gentler on sensitive tissues. For your first suspected yeast infection, I strongly recommend seeing a healthcare provider for confirmation. Other conditions can masquerade as yeast infections, and it's important to make sure you're treating the right thing. Once you've had a confirmed yeast infection and you're familiar with your symptoms, many women can successfully manage recurrent infections with over-the-counter treatments. However, if over-the-counter treatments aren't working, or if you're getting yeast infections frequently, more than 4 times a year, we need to dig deeper. Sometimes you might have a yeast infection caused by a different species of Candida that's more resistant to standard treatments. Sometimes what you think are recurrent yeast infections are actually a different condition altogether. This is when prescription treatments or further testing might be necessary. Now let's talk prevention, because I know that's what many of you really want to know about. The good news is that there are several strategies that can help reduce your risk of developing yeast infections. First, keep the genital area clean and dry. Wear breathable cotton underwear when possible, and avoid tight-fitting synthetic clothing for extended periods. Change out of wet bathing suits and sweaty workout clothes promptly. Avoid douching completely. I cannot stress this enough. Douching disrupts your natural vaginal flora and can actually increase your risk of infections. Your vagina is self-cleaning and doesn't need internal washing products. When you shower, simply wash the external genital area with mild, unscented soap and water. If you're taking antibiotics, talk to your healthcare provider about whether probiotics might help. Some studies suggest that taking probiotics containing lactobacillus can help prevent antibiotic-associated yeast infections, though more research is needed. You can find these in supplement form or in foods like yogurt with live cultures. Pay attention to your menstrual cycle patterns. Some women notice they're more susceptible to yeast infections at certain times of the month. Using unscented menstrual products and changing them frequently can help maintain a healthy vaginal environment. Sexual activity can sometimes trigger yeast infections in susceptible women, though yeast infections aren't sexually transmitted. The friction and introduction of different bacteria can sometimes disrupt the vaginal balance. Using adequate lubrication and urinating after intercourse can help reduce this risk. For women with diabetes, maintaining good blood sugar control is absolutely crucial. High blood sugar levels can promote yeast growth, so managing your diabetes effectively can significantly reduce your infection risk. If you're dealing with recurrent yeast infections, we need to look at the bigger picture. Sometimes what appears to be recurring yeast infections is actually a chronic condition that requires a different approach. We might need to do testing to identify specific yeast species, look for underlying conditions, or consider suppressive therapy to prevent recurrences. Stress management is also important. Chronic stress can weaken your immune system and disrupt your body's natural balance. Finding healthy ways to manage stress through exercise, meditation, adequate sleep, or other relaxation techniques can benefit your overall health and might help reduce your susceptibility to infections. During treatment, there are several things you can do to help manage symptoms and promote healing. Avoid sexual intercourse until the infection is completely resolved to prevent irritation and avoid passing the infection back and forth with your partner. Keep the area clean and dry and resist the urge to scratch, even though the itching can be intense. Scratching can cause additional irritation and potentially lead to secondary infections. Some women find that cool compresses or sitting in a plain cool bath can provide temporary relief. Avoid adding any products to the bath water, as these can cause additional irritation. Wearing loose, breathable clothing during treatment can also help reduce discomfort. Let me address something that often causes anxiety. The idea that having yeast infections means something is wrong with you or that you're somehow dirty or unhygienic. This is absolutely not true. Yeast infections can happen to anyone, regardless of how meticulous their hygiene is. Some women are simply more prone to them due to factors largely beyond their control: genetics, hormone levels, immune system function, or underlying health conditions. If you have a male partner, it's worth noting that while yeast infections aren't typically sexually transmitted, men can sometimes develop symptoms, particularly if they're uncircumcised or have compromised immune systems. If your partner develops symptoms like redness, itching, or irritation, they should see their healthcare provider for evaluation. I also want to address the wealth of misinformation on social media about yeast infections. You might see recommendations for things like boric acid suppositories, yogurt insertions, or various home remedies. While some of these might have some basis in science, many are unproven and some can actually be harmful. Boric acid, for instance, should only be used under medical supervision for specific types of recurrent infections. Stick to proven treatments and always consult with a healthcare provider if you're unsure. Here's something that might surprise you. Sometimes what you think is a yeast infection might actually be something called cytolytic vaginosis, or lactobacillus overgrowth. This condition can cause similar symptoms, but is actually caused by too much good bacteria rather than too much yeast. It requires different treatment, which is another reason why proper diagnosis is so important. I want to emphasize that you should never feel embarrassed about discussing these issues with your healthcare provider. Yeast infections are one of the most common reasons women visit their doctors, and we're very familiar with diagnosing and treating them. If you're experiencing symptoms, if treatments aren't working as expected, or if you have questions about prevention, please don't hesitate to reach out. Finally, I want you to remember that your vaginal health is an important part of your overall well-being. Understanding your body's normal patterns, recognizing when something is off, and knowing how to respond appropriately is a crucial part of taking care of yourself. Every woman's normal is different, so don't compare your experience to what you read online or hear from friends. The key is to stay informed, trust your instincts about your body, and maintain open communication with your healthcare provider. Yeast infections might be annoying and uncomfortable, but they're treatable and manageable. With the right knowledge and approach, you can effectively deal with them and get back to feeling comfortable and confident in your own skin. Is there anything specific about yeast infections that you'd like to discuss further? Any symptoms you've been experiencing that you're concerned about, or questions about the prevention strategies we've talked about? Remember, no question is too small or too embarrassing. I'm here to help you understand your body and maintain your health.